Let's go over the autism spectrum disorder within the context of the abnormal domain. Autism spectrum disorder is a neurodevelopmental disorder characterized by difficulties communicating and interacting within a variety of social contexts, restricted and repetitive behaviors or interests, and early onset of symptoms that ultimately cause clinically significant impairment in everyday functioning. A reliable diagnosis of autism spectrum disorder may be made as early as age 2, but symptoms may be recognized earlier than 12 months depending on the severity. Autism spectrum disorder is used to diagnose disorders that were previously classified separately, including autism, Asperger's syndrome, pervasive developmental disorder (NOS), and childhood disintegrative disorder. The term spectrum is used to represent the wide range of manifestations of the disorder that are determined by developmental level, chronological age, and the severity of the autistic condition. Severity level may be categorized as Level 1, requiring support, Level 2, requiring substantial support, or Level 3, requiring very substantial support. Specifiers include with or without accompanying intellectual impairment, with or without accompanying language impairment, associated with a known medical or genetic condition or environmental factor, associated with another neurodevelopmental, mental, or behavioral disorder, and with catatonia. Impaired social functioning is manifested by the child's inability to use and understand nonverbal behavior, that is, eye-to-eye contact, body language, and facial expressions. Impaired social communication may also include, in individuals with high levels of intellectual functioning, an inability to understand humor, irony, or shades of meaning. Children with autism spectrum disorder also do not form developmentally appropriate peer relationships, do not spontaneously attempt to share interests or enjoyment with others, and do not demonstrate social or emotional reciprocity. Children may seem oblivious to others. When they do interact, it is often in a mechanical way. For example, peers may be viewed as tools for the child's solitary play rather than equal participants. During infancy, impairment in social functioning may be evident by resistance to or passive acceptance of cuddling, lack of smiling, or failure to respond to their caregivers' voices, and a lack of joint attention, that is, following a parent's pointing to or looking at an object together. One possible explanation for the social impairments inherent in autistic disorder is that individuals with this disorder fail to develop the theory of mind, also known as TOM. That is, they do not recognize that other people's points of reference differ from their own. Impairment in communication may be so severe that children with autism spectrum disorder fail to develop any spoken language. A third or more of individuals with autism spectrum disorder remain mute throughout their lives. People with this disorder who do require spoken language demonstrate a variety of speech abnormalities, including echolalia, reversal of pronouns, idiosyncratic invented language, failure to understand the pragmatics of language, and abnormal prosody. Individuals with autism spectrum disorder are often preoccupied with a few specific interests or activities. They may adhere to strict routines and demonstrate extreme distress at small changes in their environment or activities. Additionally, people with this disorder may engage in stereotyped motor behaviors, such as flapping their hands or twisting their fingers. Behavioral symptoms associated with autism spectrum disorder include impulsivity, physical aggression, self-injurious behaviors, especially during times of stress, clumsiness, difficulty transitioning between situations, hyperactivity, limited attention spans, and abnormal reactivity to sensory input. Approximately 1% of the United States population have been diagnosed with ASD. Heritability estimates range from 37 to higher than 90%, and about 15% of the cases are linked to a known genetic mutation. People with autism spectrum disorder who have an IQ over 70 and begin using spoken language by age 5 have a better prognosis than others with the disorder. A comorbid diagnosis of epilepsy increases the risk of intellectual disability. About 70% of those with ASD also have other comorbid mental disorders. About 40% have more than one comorbid mental disorder, and symptoms and impairments tend to be present across the entire lifespan. The most effective treatments for intellectual disability are behavioral therapies such as applied behavioral analysis. Treatment of intellectual disability is most beneficial when it begins very early in the child's life. The parents are actively involved, 20 hours per week of intervention are applied, the interventions are implemented at home as well, and the child is provided with a highly structured environment. Although pharmacological interventions may not be primary interventions, first and secondary genetic antipsychotic medications may be useful for diminishing aggressive tendencies, self-injurious behavior, and emotional liability. Stimulants may help with enhancing attention and in reducing impulsivity. Let's practice with a question from the autistic spectrum disorder key term within the context of the abnormal domain. Which of the following children with autism spectrum disorder is likely to have the best prognosis? Answer A. Lacey, an 8-year-old girl with mild language delays, was diagnosed at age 7, has an IQ of 80, and is being treated with stimulant medication. B. Donovan, a 6-year-old boy who was diagnosed at age 5, has recently started speaking, has an IQ of 75, and is being treated with behavioral therapy at home. Answer C. Anya, a 5-year-old girl with language deficiencies who was diagnosed 2 months before her 5th birthday, has an IQ of 75, and is being treated with cognitive behavioral therapy at an outpatient clinic. And D. Donald, a 7-year-old boy who was diagnosed at age 6, has not yet developed language, has an IQ of 80, and is being treated with interventions at home for 20 hours per week. The correct answer is answer B, as early diagnosis and intensive in-home behavioral treatment are linked to improved outcomes. Also, girls are more likely to experience intellectual disability comorbid with autism spectrum disorder, and therefore males may have a better prognosis. Language delays and an older age at the time of diagnosis, A and D, result in a lower prognosis. Cognitive behavioral therapy outside the home, answer C, would not be linked to a higher prognosis compared to behavioral therapy at home, which is answer B.